Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a Globular Global series or edition, this audio podcast as part of a Lunar Insurgence. This audio podcast as part of a Skeletal Lobostics, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, sort of a summary as part of this as part of this as part of this audio podcast sort of edition in sort of looking at sickle cell anemia and thalassemia. So, an estimated 7% of the world population carry an abnormal hemoglobin gene, while about 300,000 to 500,000 are born annually with significant hemoglobinopathies. Sickle cell syndromes are more frequent and constitute around 70% of effective births worldwide, and the rest are due to thalassemias. Evidence in literature informs or stresses the educational importance and necessity for patients and the public to be empowered and have a capacity to link healthcare relating to history and hematological practices, including serology, immunogenetics, sickle cell anemia, thalassemia phenotypes, and immunohematology. Alternatives to transfusion, including bone marrow transplants, should be given consideration, and focused evaluations of patient or recipient populations should help provide best use of treatment options, deliberating mainly on hematology. That draws this audio podcast to a close. This audio podcast as part of a globular global. This audio podcast as part of a Lunar Insurgence, and this audio podcast as part of a Skeletal Lobostics, and this audio podcast as part of a Storm Lobostics production. As part of the audio podcast series, there will be a link to varying literature in so that listeners can identify works other published works or works in relating to and regarding to sickle cell anemia and thalassemia, sickle cell SCA and thalassemia, and will be available on varying social media as part of this audio podcast series. Thank you.